Hello and welcome to Dr. Martin Health Tips. I'm Dr. Clarence Martin, and today I'm going to share life-changing information about nerve health that could literally help you regain sensation, reduce pain, and feel like yourself again. What if I told you that a single vitamin, one that most doctors rarely even test for, has been shown in clinical studies to reverse nerve damage in as little as 14 days, even in people over 60 years old? I know that sounds almost too good to be true. I know that you've probably seen 100 headlines promising miracle supplements and wonder cures, and naturally you're skeptical. You should be. The internet is full of overhyped claims. But what I'm about to share with you today is not some myth or viral marketing gimmick. This is backed by decades of clinical research, real patient cases, and neuroscience that mainstream medicine often overlooks. I want you to take a moment and really listen, because this could be the missing piece that explains why your hands, feet, or legs feel numb, tingling, or painful. My name is Dr. Clarence Martin, and if you've been experiencing tingling, burning sensations, numbness, or loss of balance, especially at night or while walking, this video might genuinely change your life. I'm not exaggerating when I say that. Millions of people over the age of 60 are living with peripheral neuropathy, and many have never been properly tested for a simple nutritional deficiency that could be the root cause. Imagine for a moment that you're 62 years old. You used to be active, walking your dog each morning, playing with your grandchildren, maybe even tending to your garden. Then slowly, over a year or two, things start to change. First, it's just a slight numbness in your toes. You think it might be poor circulation. Then the tingling spreads up your feet into your calves. Your hands begin to feel clumsy. You start dropping things. Buttoning your shirt becomes a frustrating ordeal. At night, burning sensations keep you awake, and no amount of repositioning eases it. You go to your doctor. Blood work is done. Everything looks fine, they say. Maybe they prescribe gabapentin or another nerve pain medication that makes you feel foggy and tired all day. Sound familiar? If so, you're not alone. And here's the critical piece most people never hear about. The vitamin that could reverse much of this damage is vitamin B12. Now, some of you just thought, B12? I take a multivitamin every day. I'm fine. And that assumption is exactly what keeps so many people suffering unnecessarily. Here's why. Your ability to absorb B12 declines dramatically as you age. After 50, your stomach produces less intrinsic factor, the protein your body absolutely needs to absorb B12 from the food you eat. So even if your diet is rich in meat, fish, eggs, and dairy, and even if you take a standard multivitamin, your nerves could still be starving for B12 at the cellular level. The scary truth is that standard blood tests often miss B12 deficiency entirely. Your serum B12 might read normal, but your nerves are deprived. Why? Because the reference range is too broad. What many labs consider low normal may already be too low for optimal nerve function. Functional markers like methylmalonic acid, MMA, and homocysteine are far more sensitive indicators of B12 deficiency. These tests reveal the real B12 status in your body and highlight whether your nervous system has the raw materials it needs to function and repair itself. Let's talk about what B12 does for your nerves, because this is where the story becomes fascinating. Every nerve fiber in your body is wrapped in a protective coating called the myelin sheath. Think of it as the insulation around an electrical wire. When intact, nerve signals travel quickly and efficiently from your brain to your fingers, toes, and organs. You feel sensations properly, your muscles respond accurately, and your balance is maintained. When your B12 levels drop, the myelin sheath deteriorates. Signals start misfiring. Some fire when they shouldn't, causing tingling, burning, or pins and needles sensations. Others fail to fire at all, causing numbness. If left uncorrected, the nerve fibers themselves can sustain permanent damage. That's why early detection and correction of B12 deficiency is crucial. Here's the exciting part. Clinical studies and documented cases show that when B12 deficient patients particularly those over 60, receive the right form, dose, and delivery method of B12, nerve function can improve in as little as 14 days. I've seen this in my patients. People who could barely feel their feet start reporting sensations returning within 2 weeks. Burning pain diminishes, balance improves, sleep returns. And it's not magic, it's biochemistry. Give the nervous system the building blocks it needs, and the body begins to repair itself. But there's a catch. Not all B12 is created equal. Walk into a pharmacy, and the most common supplement is cyanocobalamin, a synthetic form your body must convert through multiple steps to use. For many over 60 or with certain genetic variations, this conversion is inefficient. The forms that matter are methylcobalamin and adenosylcobalamin. Methylcobalamin directly repairs and maintains myelin sheaths and supports production of same, S-adenosylmethionine, a crucial methyl donor for nerve regeneration. Adenosylcobalamin works primarily in the mitochondria, providing the energy your nerve cells need for repair. Supplements that include both are ideal. Now let's talk dosing. The RDA for B12 is around 2.4 micrograms daily, enough to prevent overt deficiency disease, but optimizing nerve health requires far more. Clinical studies typically use 1,000–5,000 micrograms daily, sometimes higher in the initial phase. For severe deficiency, methylcobalamin injections, given 2 to 3 times per week, bypass the digestive system and deliver B12 directly to the bloodstream, producing faster results. After the initial loading phase, high-dose sublingual B12 is an excellent alternative, absorbed under the tongue and bypassing gut absorption issues. While B12 is critical, it works best alongside other nutrients. Vitamin B1, thiamine, particularly the fat-soluble form benfotiamine, penetrates nerve cells more effectively and reduces neuropathic symptoms by protecting against toxic compounds called advanced glycation end products, AGEs. A dose of 300 to 600 mg per day with methylcobalamin can make a significant difference. Vitamin B6 is a double-edged sword. It's essential for neurotransmitter production and nerve function, but excessive doses can cause nerve damage. Stick to 25 to 50 mg daily using pyridoxal 5-phosphate, P5P, rather than pyridoxine hydrochloride. Alpha-lipoic acid is another powerhouse, a potent antioxidant. It protects and regenerates nerves, improves blood flow, and restores other antioxidants. Clinical trials use 600 mg daily to reduce neuropathic pain, burning, numbness, and tingling. It's been used for decades in Europe as a prescription therapy for diabetic neuropathy. Vitamin D deficiency is epidemic in those over 60 and strongly linked to neuropathy. Vitamin D receptors exist throughout the nervous system, supporting nerve growth, reducing inflammation, and protecting tissue. Aim for blood levels of 50–70 in gml, which may require 4,000–5,000 IU daily, with vitamin K2 for proper calcium metabolism. Magnesium is involved in over 300 enzymatic reactions, including nerve signal transmission, muscle relaxation, inflammation reduction, and blood flow support. Forms like magnesium glycinate or magnesium L-threonate are highly absorbable and neurologically beneficial. Aim for 300–400 mg elemental magnesium daily. Lifestyle matters just as much as supplementation. High blood sugar, even mildly elevated, can destroy nerves through ages, oxidative stress, and damage to the tiny vessels supplying nerves. Managing diet, focusing on whole foods, reducing refined carbs, and exercising regularly is essential. Exercise promotes blood flow, delivers nutrients to nerves, and stimulates nerve growth factors. Gentle walking, yoga, tai chi, swimming, or even chair exercises improve nerve conduction and reduce neuropathic pain by up to 30%. Sleep is critical. Nerve repair happens primarily during deep sleep. Growth hormone release, toxin clearance via the brain's lymphatic system, and tissue regeneration all occur at night. Without 7 to 8 hours of quality sleep, healing slows dramatically. Neuropathic pain can disrupt sleep, creating a vicious cycle. But with proper nutrition, lifestyle adjustments, and sleep hygiene, that cycle can be broken. Stress management is equally vital. Chronic stress floods the body with cortisol, which damages nerve tissue, raises blood sugar, and suppresses immunity. Techniques like meditation, deep breathing, journaling, prayer, connecting with loved ones, or spending time in nature are not luxuries. They're essential for nerve health. Let me share a story that highlights the power of these strategies. A 67-year-old retired teacher came to me after 3 years of worsening neuropathy. She had tried multiple medications, including gabapentin, but symptoms persisted. Her standard B12 test read normal at 210 pg/ml. However, methylmalonic acid and homocysteine tests revealed functional B12 deficiency. Her vitamin D was 18 ng/ml, magnesium low, and fasting insulin elevated. We started methylcobalamin injections 3 times per week, along with benfotiamine, alpha-lipoic acid, magnesium glycinate, and vitamin D3 with K2. We optimized her diet, increased low-impact exercise, and monitored blood sugar. Within 14 days, her burning decreased by 50%. Within 6 weeks, numbness improved and she could button her shirt again. Within 3 months, she walked 30 minutes daily without balance issues and slept through the night, discontinuing gabapentin under supervision. Every patient is different, but this story illustrates a fundamental truth. When you give the body what it needs and remove what harms it, it can heal, even after 60, even after years of being told nothing can be done. Here are practical steps you can take today. Ask your doctor for a B12 test plus methylmalonic acid and homocysteine. If over 60 with neuropathy symptoms, consider high-quality methylcobalamin 1,000 mcg daily or injections if deficiency is severe. Add benfotiamine 300 mg daily and alpha-lipoic acid 600 mg daily. Test and optimize vitamin D levels. Ensure adequate magnesium intake, preferably glycinate or L-threonate. Focus on blood sugar control with nutrient-dense, low-glycemic foods. Move daily, even with gentle activity. Prioritize quality sleep and stress management. I am not telling you to stop any prescribed medications or self-treat serious conditions. I'm telling you that B12 deficiency is massively underdiagnosed and correcting it can yield remarkable improvements. You deserve to know this. You deserve doctors who look beyond symptom management. You deserve hope. If this video helped even a little, hit the like button to reach more people. Subscribe to Dr. Martin Health Tips for weekly videos on topics your doctor may not discuss in a 15-minute appointment, and share this with loved ones experiencing nerve problems. Comment below. Have you been tested for B12? Tried any strategies here? I read every comment and love hearing from you. Your body is not broken. It's often missing a crucial piece. Give it that piece and healing becomes possible. Take action. Take care.